This video only covers selected highlights of the Remunity Pump user guide and is not intended to replace the user guide. For complete details, including warnings and cautions related to the Remunity Pump, refer to the user guide. For safety information related to Remodulin, please see the end of the video and the full prescribing information. In this video, we will cover steps to follow when setting up and using your Remunity Pump for the first time. For this chapter, you'll need your battery charger, pump batteries, and remote. Before using the Remunity Pump, you should fully charge the pump batteries. Fully charging the batteries using the dual USB AC adapter will take about 6 hours. Charging the pump batteries through a personal device using the USB cable may take longer. First, plug your USB wall adapter into an AC power outlet. Then, insert 2 rechargeable batteries into the charger. Avoid touching the electrical contacts on the battery charger when it is connected to a power source. A battery is fully charged when the status light changes from amber to green. If you see blinking red lights, consult the maintenance and troubleshooting section of your user guide. A fully charged pump battery can power the pump for 3 days or 72 hours. Each time you replace a Remodulin cassette, swap out your current pump battery with one that's fully charged. You should also charge the wireless remote's internal battery before your first use. The remote fully charges in 6 hours or less when connected to the supplied dual USB AC adapter. A fully charged remote lasts about 24 hours, and it should be charged every day. Charging may take longer if you're only using the USB cable. If you want to check your remote's battery charge, press and hold the Wake Up button located on the side of the remote. The remote is fully charged when its battery symbol is completely green. You can also use your remote to charge an additional pump battery at the same time. The remote will only charge a pump battery when plugged into a power source. Consider charging your remote overnight while you sleep. Remember, you should obtain new batteries from your specialty pharmacy every 3 months for your pump and every 12 months for your remote. Once the batteries are fully charged, it's time to pair your pump and remote. For this chapter, you'll need a fully charged pump battery, remote, and your Remunity Pump. Please note that certain electronics may affect communication between the pump and remote. If your pump and remote are unable to pair together or remain paired, move at least 3 feet away from cell phones, Bluetooth devices, equipment that sends or receives radio waves, and Wi-Fi equipment, and repair your programmer and pump. Your remote will automatically search for a pump when it turns on. First, press the side button found on the remote to wake it up. Then, unlock the remote screen by pressing each front button from left to right. The remote will stay active for 2 minutes before entering sleep mode. Set your remote down and pick up your Remunity Pump. Notice that your pump is attached to a clear dust cover. Remove this dust cover by holding it in one hand and rotating the pump counterclockwise with the other hand. Then lift. Store the dust cover with your other supplies. Next, insert the fully charged battery into the pump. The pump will already be in pairing mode. If you hear something else, consult the troubleshooting pump section of your user guide. Next, locate your pump serial number on the bottom. Then place it within 2 inches of the remote during the pairing process. Your pump serial number should appear on your remote screen after 1 minute. If your pump serial number does not appear on your remote screen, press and hold the pump's blue button for 10 seconds to resend a signal to the remote, then check again. Once your pump serial number appears on the remote screen, use the front buttons on the remote to highlight and select the pump serial number. Press the check mark once pairing is successful. The remote will display your pump serial number once it has successfully paired with the pump. Press the check mark if the serial number displayed on the remote matches the serial number of your pump. If the remote is paired with the wrong pump, select the gear and try again. If pairing fails, see the Pairing Failed attention alarm in your user guide. Once your remote and pump are paired, your remote will ask for a delivery rate, which is the amount of medication the pump will deliver hourly. Set your prescribed rate and confirm by selecting the check mark. Now you're ready to prime a cassette. Remunity Pump for Remodulin Treprostinil Injection. Indication: the Remunity Pump for Remodulin Treprostinil Injection is intended for continuous subcutaneous delivery of Remodulin Treprostinil Injection for use in adults greater than 22 years of age. Important safety information for Remunity. Warnings and cautions. Do not use the system outside the conditions listed in the user guide. Retain the user guide for future reference. Refer to the user guide for all warnings and cautions. Failure to comply with the following warnings and cautions may result in harm. Limited to use with Remodulin. Only Remunity cassettes may be used with the Remunity Pump. Remunity Pump is for use only with FDA-cleared infusion sets. Medtronic Quickset Infusion Set, MMT-392, MMT-393. Medtronic Silhouette Infusion Set, MMT-373, and Smith's Medical Clio 90 Infusion Set, 21-7230-24, 21-7220-24. Do not use disposables from previously opened or damaged sterile packaging, damaged disposable components, or expired sterile components. Discontinue use of the remote and switch to the spare remote in the event the remote fails to operate. The use of cables, batteries, and battery chargers other than those provided or specified may result in increased emission or decreased immunity of the Remunity Pump infusion system. Do not disconnect the pump from the cassette while the cassette is connected to the catheter. Avoid exposure of your pump and cassette to temperatures below 41 degrees Fahrenheit, 5 degrees Celsius, or above 104 degrees Fahrenheit, 40 degrees Celsius. The pump may affect nearby electrical and electronic devices, including medical devices, cell phones, Bluetooth devices, RFID readers, Wi-Fi equipment, and strong magnetic fields, causing these devices to operate abnormally or to stop functioning. Do not open, crush, heat above 140 degrees Fahrenheit, 60 degrees Celsius, or incinerate the pump battery or remote, as doing so can lead to fire or rapid spreading of fire resulting in harm. This system supports flow rates between 16 microliters per hour and 225 microliters per hour. If your flow rate is outside this range, discuss with your healthcare practitioner. Prescription information. Caution: Federal law, USA, restricts this device to sale by or on the order of a licensed healthcare practitioner. Use of this device without the training and supervision of a healthcare practitioner may lead to errors that result in harm. See the Remunity Pump for Remodulin Treprostinil Injection Pharmacy-Filled User Guide for further detailed important safety information including warnings, cautions, and instructions on how to properly use the system. For further information, please call United Therapeutics Corps at 1-877-864-8437. The Remunity Pump for Remodulin Treprostinil Injection is manufactured for United Therapeutics Corps. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. Remodulin Treprostinil Injection. Indication or what is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver or kidney problems. Your Remodulin dose may need to be adjusted if you have liver problems. Have low blood pressure or bleeding problems. Are taking Gemfibrozil for high cholesterol, Rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure. Symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilatation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-877-UNITHER, 1-877-864-8437.